There comes a moment that many dog owners never see coming. It doesn't begin with a dramatic emergency. Your dog doesn't suddenly collapse or cry out in pain. Instead, the changes are so small that they're almost impossible to notice. Maybe your dog finishes the water bowl faster than usual. You refill it without thinking. A few days later, you notice they're asking to go outside more often. You assume they're simply drinking more because of the weather. Then the appetite changes. They seem a little less excited about dinner. They sleep a little longer. They've lost a little weight. Nothing feels urgent. Nothing feels alarming. But what if all of those tiny changes were connected? What if your dog's body had been trying to warn you for weeks or even months before obvious symptoms ever appeared? Kidney disease is one of the most common health problems affecting older dogs, yet it's also one of the easiest to miss during its earliest stages. That's because the kidneys are remarkably resilient. They continue working even after significant damage has already occurred. By the time many owners realize something is wrong, the disease has often been developing silently for a very long time. The good news is that dogs rarely become seriously ill without giving clues first. The clues are simply quiet. Today, we're going to uncover 9 silent warning signs that could suggest your dog's kidneys are struggling, explain why these symptoms happen, and help you understand when it's time to seek veterinary care. Because when it comes to kidney disease, recognizing the warning signs early can make all the difference. Before we look at those warning signs, let's understand what the kidneys actually do. Most people think the kidneys simply make urine. In reality, they're among the hardest working organs in the entire body. Every minute of every day, blood flows through this kidneys where millions of tiny filtering units remove waste products, balance fluids, regulate important minerals, help control blood pressure, and support the production of healthy red blood cells. Think of the kidneys as your dog's natural filtration system. When they're working properly, harmful waste leaves the body quietly through urine. But when those filters begin to fail, toxins gradually remain in the bloodstream instead of being removed. At first, the body compensates remarkably well. Healthy portions of the kidneys work harder to make up for damaged areas. This compensation is one reason kidney disease often develops unnoticed. Your dog may appear completely normal even while important changes are already taking place inside the body. Eventually, however, compensation is no longer enough. That's when the silent signs begin appearing. The first warning sign is increased thirst. Many owners actually notice this before anything else. One day, you're filling the water bowl as usual. A week later, you're filling it twice. Soon, it seems empty every time you walk past. At first, drinking more water doesn't seem like a problem. After all, staying hydrated sounds healthy. But in dogs with kidney disease, excessive thirst often develops because the kidneys are losing their ability to concentrate urine properly. Instead of conserving water, they allow large amounts to leave the body. To compensate for those fluid losses, the brain signals the dog to drink more and more. Owners often assume warm weather is responsible. Sometimes it is. But persistent changes in water consumption deserve attention, especially in middle-aged and senior dogs. The second warning sign usually follows close behind. Frequent urination. If more water is entering the body, more water naturally leaves it. Dogs that previously slept comfortably through the night may suddenly ask to go outside before morning. House-trained dogs may have accidents indoors for the first time in years. Some owners mistakenly believe their dog is developing behavioral problems. In reality, the kidneys may simply no longer be able to conserve water efficiently. One subtle clue many owners overlook is the appearance of the urine itself. Large volumes of unusually pale urine can sometimes accompany chronic kidney disease because the kidneys are no longer concentrating waste products normally. These changes aren't unique to kidney disease, but when they appear alongside increased thirst, they become much more meaningful. The third warning sign is gradual weight loss. This isn't the dramatic weight loss people notice overnight. It's slow, almost invisible. You don't notice it because you see your dog every day. And then one afternoon, someone who hasn't visited in months says, "Has your dog gotten thinner?" Suddenly, you realize the ribs feel more noticeable than they used to. The waist looks narrower, the muscles around the back leg seem smaller. Weight loss happens because chronic kidney disease affects far more than the kidneys themselves. As waste products build inside the bloodstream, dogs often begin eating less. Muscle tissue gradually breaks down. The body becomes less efficient at maintaining a healthy weight. And because the process happens slowly, owners frequently blame aging instead. But healthy aging should never automatically mean unexplained weight loss. The fourth warning sign is a reduced appetite. This often develops gradually rather than disappearing all at once. Maybe your dog leaves a few bites behind. Maybe they no longer rush to the food bowl. Perhaps they refuse breakfast but eat dinner. Small changes, easy to ignore. Inside the body, however, something important is happening. As toxins accumulate in the bloodstream, many dogs begin feeling mildly nauseated. Food simply doesn't seem appealing anymore. Some owners buy several different brands of food, assuming their dog has become picky. Others begin adding table scraps to encourage eating. Sometimes those changes seem to help for a day or two. Then the appetite declines again. The problem was never the food. The problem was how the dog felt. The fifth warning sign surprises many owners. Bad breath? Not the normal dog breath most people joke about, something different. Some owners describe it as smelling like ammonia. Others say it has a metallic or chemical odor. This happens because waste products that healthy kidneys normally remove begin accumulating throughout the body. Some of those compounds can affect the breath, creating a smell that many veterinarians recognize immediately. Occasionally, mouth ulcers may also develop as toxin levels increase. Eating becomes uncomfortable. Appetite declines even further. Once again, one symptom begins feeding another. The body rarely experiences kidney disease in isolation. Everything is connected, and perhaps that's the most important lesson. Kidney disease doesn't suddenly appear one morning. It quietly changes one small thing at a time. A little more water, a little more urine, a little less food, a little less weight. Each change seems harmless on its own. Together, they're telling a story. The question is, will anyone recognize it before the damage becomes severe? But those first 5 warning signs are only part of the story. As kidney disease progresses, the body begins sending even clearer signals. Unfortunately, these are often the signs that convince owners something is seriously wrong. By then, the kidneys may have already lost a significant amount of their normal function. That's why recognizing what comes next is so important. The 6th silent warning sign is something many families mistake for old age, a noticeable drop in energy. Maybe your dog no longer races to greet you at the front door. The daily walk becomes shorter. Instead of chasing the ball one more time, they lie down after only a few throws. They spend more time sleeping, less time exploring, less time playing. It's tempting to think, well, they're just getting older. But healthy aging and chronic illness are not the same thing. Age alone doesn't explain a sudden loss of enthusiasm for life. When the kidneys struggle to remove waste from the bloodstream, every organ begins feeling the effects. Those toxins circulate throughout the body, making dogs feel tired, weak, and generally unwell. Imagine trying to go about your day while feeling like you have the flu that never completely goes away. That's how many dogs with advancing kidney disease feel. They still want to be close to you. They still wag their tail, but they simply don't have the energy they once did. The 7th warning sign is one that many owners never connect to kidney disease at all: vomiting. At first, it may happen only once every week or two. You assume your dog simply ate something that upset their stomach. Then it happens again and again. Over time, vomiting may become more frequent, especially in the morning or after meals. But the stomach isn't the real problem. The kidneys are. As waste products continue building up in the bloodstream, they begin irritating the stomach lining and triggering nausea. Some dogs start licking their lips repeatedly. Others drool more than usual. Some walk toward their food bowl looking hungry, only to turn away after one sniff. It's heartbreaking to watch because you can tell they want to eat. They just don't feel well enough to do it. Then comes the 8th warning sign: changes in the appearance of the coat. Healthy dogs usually have soft, clean, shiny fur. Dogs living with chronic illness often don't. The coat may begin looking dull, dry, rough, even unkempt. You may notice increased shedding or flaky skin. Some dogs stop grooming themselves properly because they simply don't have the energy. Others become dehydrated, causing the skin and coat to lose their healthy appearance. These changes develop gradually. One day you look at an old photograph and suddenly realize your dog doesn't quite look the same anymore. It's amazing how slowly illness can change appearance without us noticing. The 9th warning sign is perhaps the most important of them all: dehydration. This may sound confusing. After all, we just talked about dogs drinking more water. How can they be dehydrated if they're drinking constantly? The answer lies in how damaged kidneys function. Healthy kidneys carefully control how much water stays inside the body. Diseased kidneys lose that ability. Even though your dog drinks more, they're also losing far more fluid through their urine. Eventually, they can't keep up. The body begins drying out from the inside. You might notice dry or sticky gums, sunken eyes, loss of skin elasticity, extreme weakness. In severe cases, dehydration becomes a medical emergency requiring immediate treatment. And that's why kidney disease creates such a dangerous cycle. The kidneys lose water, the dog drinks more, the kidneys lose even more water. The cycle continues until treatment interrupts it. But here's something many people don't realize. Not every dog with kidney disease shows all 9 warning signs. Some dogs only show 2 or 3. Others develop symptoms in a completely different order. That's why veterinarians never rely on a single symptom. Instead, they look at the entire picture: a little more thirst, a little more urination, a little less appetite, a little more weight loss. Each clue may seem small. Together, they paint a much larger story. So when should you call your veterinarian? The answer is simple: as soon as you notice persistent changes. Don't wait until your dog stops eating completely. Don't wait until they're vomiting every day. Don't wait until they're too weak to enjoy their favorite activities. Kidney disease cannot usually be reversed once significant damage has occurred. But in many dogs, early diagnosis can slow the disease dramatically. Months can become years, and those years can still be filled with happy walks, family adventures, and countless tail wags. When you visit the veterinary clinic, your veterinarian will begin by asking questions that may seem surprisingly detailed. How much water is your dog drinking? Have they been urinating more often? Has their appetite changed? Have you noticed weight loss? Have they been vomiting? Every answer helps narrow the list of possible causes. Next comes a thorough physical examination. Your veterinarian checks body condition, hydration, heart rate, blood pressure, the abdomen, the mouth, and overall muscle mass. But because kidney disease often develops silently, blood work and urine testing become some of the most valuable diagnostic tools. Blood tests measure important waste products like creatinine and blood urea nitrogen, often called BUN, along with newer markers such as SDMA that may detect kidney disease even earlier. A urine sample shows how well the kidneys are concentrating urine, and whether protein, infection, or other abnormalities are present. In some cases, ultrasound imaging allows veterinarians to examine the kidneys directly, revealing changes in size, shape, or internal structure that can't be detected from the outside. Many owners become frightened after hearing the diagnosis. But a diagnosis is not the end of the story. In many cases, it's the beginning of a treatment plan. Depending on the stage of disease, treatment may include specially formulated kidney diets, medications to control blood pressure, treatments to reduce nausea, phosphorus management, hydration therapy, and regular monitoring. These treatments don't magically create new kidneys, but they can reduce stress on the kidneys that remain, helping them work more efficiently for much longer. And perhaps the greatest gift early treatment provides isn't simply more time, it's better quality of life. A dog that feels well will eat better, sleep comfortably, enjoy walks again, play with the family, and continue making memories that might never have happened if the warning signs had been ignored. The truth is, kidney disease is called a silent disease for a reason. It doesn't usually announce itself with flashing warning lights. It whispers, one extra trip to the water bowl, one accident in the house, one skipped meal, 1 pound quietly lost. Each whisper is easy to dismiss, but together they become a message no loving owner should ignore. Your dog can't tell you their kidneys are struggling. They can't explain that they're nauseous. They can't say they're thirsty all the time. They communicate the only way they can, through changes in their daily routine. The question isn't whether they're communicating. The question is whether we're listening. Because catching kidney disease early doesn't just protect the kidneys, it protects the moments that matter most. The walks, the greetings at the front door, the happy tail wag, the quiet evenings by your side. Sometimes, noticing one small change today can help protect countless precious tomorrows.